That might be
Thanks.
Laura who just joined us, or whoever Wichita Quaker is.
No, I just got my computer working.
Oh, hey, okay. So let's go ahead and up next we have Jessica and Kathy are going to lead us in some discussion around the facts about healthcare and poverty. And we want you to think about how COVID-19 has worsened and revealed poverty and other injustices in your community. So kind of keep that question in your mind, and I'll let Kathy and Jessica take it away.
Okay, I have a little slideshow just to get us kind of help us collect our thoughts around that question that Mary just posed. And I'm going to attempt to share my screen, so bear with me here. Okay, can make that bigger maybe.
Kathy, just go to the little box that says present and it'll show us the whole thing. And then you can go to your little green thing that will make it full screen. There you go, perfect.
Here we go, we're up. So I'm just gonna go through a few slides and read these, and just to help us collect our thoughts. So we're talking about today healthcare and how that is a human right. And we're talking a little bit about what happens when we didn't expand Medicaid in Kansas, that we do have a coverage gap. People are making too much money for Medicaid, but they're not making enough to afford insurance in the marketplace. And this affects 2.4 million Americans and 150,000 in Kansas. Medical debt is the #1 cause of personal bankruptcy filings, with an estimated 40% of Americans taking on debt because of medical issues. Of course, that meant that most likely could possibly go up at this point. We're still kind of sorting all that out, but it's not looking positive. This talks about rural hospitals in Kansas. 1/3 of the rural hospitals, which is more than 30 hospitals, are considered financially vulnerable. 4 have closed in recent years. Go on. This, we're talking about COVID-19. It's revealed deep social and economic failures and will reinforce existing health inequities. We've heard, the news lately that coronavirus is infecting Black people at disproportionately high rates. A little bit about the statistics. Black people make up about 16% of cases. 6% of the Kansas state population is Black. It looks like we don't have race information for about 1/4 of cases. And this was just from about a week ago. So it's as current as I could find. I think we all know this, but just reviewing, Black Americans have higher rates of chronic disease like diabetes and asthma compared to white Americans, according to data from the CDC. These underlying conditions make getting COVID-19 more deadly. Black Americans are also less likely to have health insurance, according to the Kaiser Health Foundation. This talks more about poverty and racism and how they impact health. Growing up in poverty is associated with toxic stress, of which the impact can reach crisis levels when a person is also grappling with the toxic stress brought on by racism. Hunger, lack of adequate food can lead to chronic illness. Lack of clean water, exposure to lead paint, and air pollution can negatively impact both mental and physical health. There was a study published just last week, or actually, I'm sorry, it was this week. It was a Harvard study, and it's confirming that coronavirus patients in areas that had high levels of air pollution before the pandemic are more likely to die from the infection than patients in cleaner parts of the country. The Harvard study offers the first clear link between long-term exposure to pollution and COVID-19 death rates. And we all know that poor neighborhoods and communities of color tend to be exposed to higher levels of air pollution than affluent white communities. And the last two slides here are just about, we've probably seen this in the news, but just some of the things that our leadership has mentioned about expanding CanCare and how the state would be in a better shape financially at this point with the pandemic had we expanded Medicaid. A quote from Governor Kelly, they would have had better bottom lines and better cushions to ride through this, and then better ongoing revenue. We also have support for CanCare expansion from Republican Senate Majority Leader Jim Denning. You can all see that, just emphasizing again that passing Medicaid expansion would help the state bounce back after the pandemic. This is from a slide from the national campaign. Power for poor people will really mean having the ability, the togetherness, the assertiveness, and the aggressiveness to make the power structure of this nation say yes when they may be desirous to say no. And I'll just pull this question up again that we're gonna open up the discussion. How has COVID-19 worsened and revealed poverty and other injustices in your community?
And folks, if you want to if you do have something that you'd like to open up the discussion with, for example, for me, the environmental impact and how air pollution and water pollution affect our health and can cause chronic illnesses on top of coronavirus. It's outrageous what we've done to our Mother Earth.
Thanks, Mary and Kathy. I want to move us to a little bit to talk about some resources from the Poor People's Campaign and a national call for moral revival. So Kathy led us through a number of different pieces and specifically focused here in Kansas. And we also have some pieces focused nationally. So I just want to show that this is, the site is from the Poor People's Campaign site. And there's a number of resources here, including the tab I'm going to go to next about who and what was left out of the COVID-19 stimulus bill. So as we think about the question that we're going to be discussing, we can also think about these pieces. There's a fact sheet you can download here as a PDF if you want to distribute this, but all this information on the fact sheet is also listed here. I'm just going to read this top paragraph. Epidemics emerge along the fissures of our society, reflecting not only the biology of the infectious agent, but patterns of marginalization, exclusion, and discrimination. And the coronavirus pandemic is no exception. COVID-19 has revealed deep social and economic failures and will reinforce existing health inequities. And so what is listed here from the national campaign just helps us to walk through some of those and what is left out of the stimulus. So some of the pieces here, and these relate directly back to the 5 pillars that the Poor People's Campaign is seeking to address of poverty, systemic racism, militarism and the war economy, ecological devastation, and the distorted moral narrative, and how these interlocking injustices work together and are both revealed and worsened in our current crisis. So there's information listed here about health, that the legislation provides for free testing but doesn't go far enough, as a number of uninsured people can't afford to see a doctor and have no guarantee to free or affordable treatment. Healthcare workers, and we'll hear a little bit more about this later, are inadequately protected. And we've heard already about rural hospitals, particularly, or we've heard specifically in Kansas. Essential workers, 48% of the workforce, including essential workers, did not receive paid leave. We have some of our own leaders with the Kansas Poor People's Campaign who are essential workers who are working today, and some have not received that paid leave. There's no guarantees for living wages or adequate incomes for all. We can read more about those statistics here. The legislation does not provide adequate housing, food, water, or childcare. No permanent debt relief for medical debt, housing debt, or student debt. Issues of immigration and incarceration. Millions of undocumented people and their children are excluded, while millions more who are incarcerated and detained have no safety protections. There's more information here about the amount of money needed for resources to ensure voter participation, and what was left out of the stimulus package there, as well as wealth inequality and militarism. Corporations and Wall Street were well provided for, and the military received resources that it didn't need. And so then here at the bottom, we cannot return to normal. And so part of the work of the campaign is also a petition that relates to the demands of the Poor People's Campaign. Let me just get to that. Here we are. And we'll talk a little bit more about this later, but I just wanted to bring it up now. So all of those things that have been left out of that stimulus package, as well as the other pieces that we are going to talk about, are listed in here as some of the demands for the campaign. And we'll talk a little bit more about this later. But I'll stop sharing now and toss it back to Kathy for our discussion.
Okay, so yeah, so now that we've got sort of more facts out there and maybe get us thinking about ways, the question again was, how has COVID-19 worsened and revealed poverty and other injustices in our communities?
And I'll just note that in the chat, we had a couple of things shared in response to this question. One of them is from Shelby, says that part of my community are those with pre-existing conditions without health care, and COVID-19 has struck a number of them, and they were put on the quote bottom of the list to be given a hospital bed. And Reverend Marcy shares that one of the homeless folks that she works with that went to the ER was tested, and he needed a cigarette, and when he went outside to smoke, he was arrested. So just a couple of examples of the ways in which those most vulnerable communities are continuing to be exploited and not getting access to the things they need. And then if anybody would like to take their mute button off and say something, this is a moment you can do that.
Good morning, this is Chris Omni once again, affectionately known as the Health Hippie. And to address your question in terms of injustices, I guess I'm gonna use the word pissed off. I'm gonna use that same word that the Reverend used in terms of, at least we are having the discussion about the underlying health conditions impacting Black America. Now that COVID-19 is the pandemic and everybody is discussing it, but at least we are also talking about what has led to these underlying conditions. So in terms of the injustices that are being faced by Black people, when you're looking at diabetes and hypertension and obesity, is not just a matter of that personal piece, but there are institutions that have let Black people down. There are systems that have let Black people down. There is a time for personal responsibility, and I absolutely get that and recommend that, but you have to look at the larger picture. Environmental injustice ties directly into this conversation, but the injustices that you're talking about with the diabetes, hypertension, and obesity in relation to COVID-19 is not just a personal responsibility issue. Thank you.
Thank you.
Right on. The systems put up so many walls against people, and especially Black and brown people. And I'm happy to hear people say they're pissed off today, because I've been pissed off about it for a long freaking time.
Amen. One of the communities that I work with is communities who are here because they're seeking asylum. And so a year ago, I ended up helping sponsor a family from El Salvador that spent an entire year walking here from their home across many kinds of struggle and difficulty. But I'm just really aware that they already didn't have access to all the things that we have access to. That's not my dog. I don't know who's got a dog that's barking. It's not me. I don't have, I'm aware that they don't have access to work. They don't have access to healthcare. They don't have access to driving places. Everything they have access to through me. And I'm not enough. Like, I can't replace all the systems that aren't there to help them. And I can't replace the fact that they don't even have a court hearing to decide if they're going to be allowed to be asylum seekers until 2022. So somehow I've got to help get this family of almost 5 now, the mom is pregnant, through a pandemic on top of what was already going to be kind of an impossible situation. And I know that the family I'm working with has way more access to resources because of the communities I brought with me to help them than many other immigrants have in our communities. So many other immigrant families are struggling with these same things, and they don't have 5 to 10 families from their community helping them out in the ways that we are. So I'm really holding those communities and knowing that they have even less than the less that the rest of us have. Like, we're so screwed, y'all.
Yes, I would jump in and say I don't have a personal story from Salina, Kansas, but just hearing from stories from around the country, just hearing that essential workers who include grocery staff or like janitorial staff, all these people never made wage which is high enough to even afford rent in these places, and these people are considered essential now. So which means that they have to expose themselves to this virus because of their job, and on top of that their salary doesn't let them afford healthcare. So basically these people many of them are without healthcare, exposing themselves on the front line. So that is really pathetic.
I think about the disability community who, in a lot of ways, has been isolated before COVID-19, and then is more isolated today in terms of those who need help with personal care assistance, and then just navigating getting from one place to another when you don't have a car or you can't drive, thinking about how some lives are disposable. So how do you decide, who gets the ventilator, who gets the medical attention, and if somebody with a disability is put on the bottom of the list simply because they are people that have disabilities. So it seems to be, which we knew this to be true, but it seems to be even more this survival of the fittest mentality. So that's a little scary for me.
I'll just know we've had a couple other
I
things.
am
Go ahead.
deeply I was going to say the state of our healthcare system currently is just deeply sad and totally inadequate for our current population. But in doing work around bailout justice and in light of Black Maternal Healthcare Week, pregnant people are at more of a vulnerable position, and especially when incarcerated. This weekend, Real Justice is launching the bailout campaign that they do every year early because of COVID-19. There are stories of Black people with pre-existing conditions that were supposed to be released, but were not released. And then when these Black folk are released because they don't have healthcare, they don't have adequate housing, they're released to homes where this spread is more likely to happen. So these folks go into the system, not charged with a crime, are let out, do not have the support services to deal with their addiction, and then are living in houses with 5 or 6 people. So it's just another thing that we have to hold in our hearts, is that there are prisoners rioting because they don't have personal protection equipment, they don't have support services after they get out, and they're held illegally because they have not been convicted.
Thank you, Ashanti. I wanted to just point out we had a couple of things added into the chat box. A mention about bad theology, which as a minister I especially dislike, and the ways in which that has kept people from taking the precautions they need to, or followed really what is probably bad leadership. A comment from Jess that says that Callie Greer from the Poor People's Campaign says that the system is working exactly the way it was designed to, because the system wasn't made to work for us. I have a big amen for that. What we're seeing is a system that was actually designed to do what it's doing, to kill people of color at a greater rate than other folks, to keep exploiting low-income wage workers and those of us who don't have access to the resources in the first place, to keep us in a position of not having a choice about how we use our labor. Just some other hallelujahs related to those comments. I threw in here also that we also have youth in detention and immigrants in detention, and no good plan for getting them out of what is a very high risk situation in a way that maintains safety and health for them. So just freeing them isn't good enough. We've got to have a way to liberate people from that situation in a way that's safe and honors their life. Any other, somebody just put real life Lord of the Flies, amen. And it's not funny, but Jesus, that's where we're at. Anyone else want to step in before we move to the next sort of piece of the discussion?
Well, yeah, I was gonna say that that comment about Lord of the Flies, that's it. You got the big money that they bailed out, the millionaires, and that money that they say they didn't have for medical or expanding anything, they could have used that for that. So that's another one of those.
Yeah. Ashara, that's kind of similar to what I was kind of picking up in a lot of the things that people were talking about, is that it's even before COVID-19, and we knew this, is that it's a system that is designed to put profits over people, and we're seeing that just in really stark ways now in the midst of this.
Yeah.
Mary, you want to take us to the next place?
Yeah, next up we have Charles and Anne is going to share a story with us, and Charles is going to talk about some more interlocking injustices. So go ahead.
Hi, everybody. Can you hear me? Good. Well, thanks for giving me a chance to, I feel like I want to share a tale of two visions, and the Wichita Quaker kind of alluded to this earlier. You know, if the corona, so the one vision is a vision of rugged isolationism, or everybody for themselves, or disconnectedness, or whatever you want to call it. And the other vision is a vision of interconnectedness, or, you know, how much we really need each other. And if the coronavirus has taught us anything, it's how deeply interconnected we are with each other and how much we really need each other. It doesn't stop at any borders, and it doesn't discriminate against who it strikes. We're a collective people, so we're learning that parochial individualist approaches don't work in stamping out the virus. And really, they don't work much very well for anything. So just like it's with healthcare, more universal approaches work much better for the common good. So anyway, before I ask Ann to kind of share a vision of peacemaking, I just wanted to kind of contrast, starting with this vision of doesn't work, and then some ideas for what happens when we realize how connected we are. So in this vision of disconnectedness, instead of taking a cooperative universal approach to finding personal protective gear for healthcare workers, instead states bid against each other for it, driving up the costs. You know, instead of enacting a coordinated national approach to community-wide shutdowns, this administration advocates for like piecemeal state-by-state solutions. And so what happens is a clumsy, confusing, disorganized rollout, which tragically leads to a greater overall number of infections from the coronavirus. When we don't recognize our interconnectedness, corporations privatize their profits, but socialize their debts. And this really pisses me off. It's been funny how quote unquote welfare is such a dirty word, except when it comes to corporations. And now all of a sudden, welfare is fine. It's just peachy, you know, corporate welfare is just peachy. Really ticks me off. When we don't have a vision of our interconnectedness, we monetize necessity. So the things that should be a human right, like healthcare and housing and education, they become too damn expensive for too many people. And I'm tired of seeing too many families choosing between paying rent or buying food for the month. Also, somebody alluded to earlier, we attach our healthcare to our work. So we've had this reality now of 22 million people are suddenly unemployed, and at the same time now they don't have health care when they need it the most. Somebody's hurting my people, and I won't be silent anymore. When we don't realize our interconnectedness, we tolerate these insane situations, like the top 3 families in the United States own more than the bottom half of the country. We allow the top 1% of our country to own more wealth than the bottom 92%. It's insane, it's ridiculous. And so in the meantime, in the richest country in the world, 500,000 people go to sleep on the streets every night. And this one, I'm a homeless outreach worker. The pay's not too good, but at least the hours are lousy. So in Kansas, we dare ask, okay, so look, we can solve this problem of homelessness. I've been part of the solution. We're solving it, but we just don't have the political will. All we need to do is put a little bit more muscle and more resources to it, and we can bring it to zero. So there is hope. And in Kansas, we dare ask, we in the Poor People's Campaign dare ask, with all this preposterous wealth in this state, why must 140,000 people go without health care? It frickin' boggles the mind. Somebody's hurting my people, and I won't be silent anymore. Instead of realizing the effect on others, churches egotistically believe that they're quote unquote immune from the virus, so they egotistically gather in large numbers, creating brand new clusters of the deadly virus. And they forget the words of Jesus himself, who said, whenever more are gathered in my name, run away, you might get the coronavirus. I mean, that's not a lot of people know about that passage, but you gotta look hard, it's in there. So those without the capital get the punishment. So people that have committed nonviolent crimes get a death sentence when they go to prison because they can get the coronavirus and die. It is.
Okay, you muted for a moment.
What?
You were muted for a moment. We lost part of what you just said.
Careful with your clicker.
Can you hear me now?
Yep.
Oh, yeah, I'm pretty emotional, and so I start moving my hand up and down, and I think I might have shut us off. Sorry about that.
It's okay.
So did you get the part about those without the capital get the punishment?
No, say that again.
Those without the capital get the punishment. People who have committed nonviolent crimes get the death sentence when they go to prison because they can die from the coronavirus, or they get murdered while they're locked up, or they drop into such deep despair. And I've been locked up, and you feel like taking your life by your own hand. Somebody's hurting my people, and I won't be silent anymore. On the other hand, here's what happens when we recognize our profound interconnectedness. We suddenly realize the value of our everyday workers: truck drivers, letter carriers, nurses and attendant care workers, grocery clerks and stockers, janitors, delivery people, garbage collectors. They're now becoming our unsung hero. And I just want to say, we boldly say, pay them a living, loving wage. Housing and healthcare become a human right when we recognize how much we need each other. We dare decide to invest in our people instead of criminalizing and deporting them. The prisons empty out while the schools and the on-the-job training sites fill up. When we realize how much we need each other, people of color and their allies demand an end to these gross inequities, disproportionate mass incarceration, and as been stated before, the fact that the African-American community represents about 14% of the country and almost half are dying from the coronavirus. Everybody's got a right to live. So when we realize how connected we are, churches, instead of being privatized, passive, pious rituals, become places of active liberation and profound transformation. Women refuse to give their bodies to local, state, and federal politicians. Immigrants and their allies fight to end the demonization of undocumented people. It's just pure demonization. And we work for comprehensive immigration reform. Everybody's got a right to live, and everybody's got a right to live with dignity. And I do see some hope. I just want to close by saying Peter Morin, the co-founder of the Catholic Worker Movement, once said, if everybody would try to be better instead of better off, everybody would be better off. And so corporations, we're coming for you. We demand that you become better public citizens and do your part in creating equality. And so if there's a silver lining in this pain and suffering that we're seeing, and people have mentioned this before, it's perhaps that we as a people will fully realize how unjust, how unsustainable, and how utterly dysfunctional our current economic system is. We won't be silent anymore. And I'd also, Anne Solentrop, a registered nurse, has brought a real vision of peacemaking to our area for sure and around the country. And so I'd like to just ask Anne to add a few words. Thanks.
Anne, are you on mute?
I think I got off now.
There you are.
I'm a pediatric nurse, been in the Kansas City area for 45 years, working with different populations in Kansas, Wyandotte County mostly, Johnson County. And I'm a member of the Physicians for Social Responsibility, the Kansas City chapter. Basically, I'm the only member here. But also a member of PeaceWorks Kansas City. And, you know, I can speak from a peace and justice perspective about the coronavirus pandemic, which has laid bare the health system's inequalities towards the poor, the unhoused, immigrant detainees, the incarcerated, people of color. And these groups have a distinct disadvantage when dealing with this deadly virus. Lack of coverage of health care, higher rates of chronic illnesses, inability to shelter with social distancing, and the higher proportion of frontline workers in the working class account for the higher death rates. For example, in some cities, people of color have up to 6 times higher death rate than others. The lack of enough PPE or personal protective equipment is due to the system's lack of planning and the low priority placed on public health care. I used to be a public health nurse when I first started out. And billions and billions of dollars are spent on so-called defense and nuclear weapons, and a mere pittance is spent on healthcare and human needs, such as housing, paid time off, family leave, childcare. The lack of universal health coverage is placing the entire population at risk, as people hesitate to go for medical care due to fear of high medical bills. So the virus is spreading more widely. Immigrant fears of deportation cause the same problem. And I can point to the Taiwan's public health response to starkly contrast that of the US. Taiwan is right off the coast of China, but it had a very early, I think January 1st, an aggressive response to the virus. They had experienced SARS, the SARS outbreak previously. So they were ready, and they went into action right away. They had massive testing, social distancing, intensive surveillance of travelers, tracking and quarantining the known cases. So they've had about 390 cases total and just 5 deaths to date. So public health should be more of a priority. And that's what Physicians for Social Responsibility is about. It's about public health issues like nuclear weapons and climate change that can totally wipe out the Earth's population and, you know, other species too. And since the virus has quarantined me, I've been able to sit and read and be on Zoom webinars and watch PBS more. So I've really come to understand a little bit better what is going on in our society. And I read Falter by Bill McKibben. He founded 350.org. And in there, he talks about Ayn Rand. I guess that's how you pronounce her name. And I kind of had heard about her, but this really, really made it much more clear to me how this philosophy is all about the individual being king. They don't want any government. And, you know, that made me think of the movie The Corporation, which I had watched a few years back, and, you know, how psychopathic the whole corporate world is. And then the Gene was on recently, Ken Burns talking about genetic, and Falter talks about this also, Bill McKibben, how they're using this extreme wealth they're looking to genetically modify people. And, you know, it's just crazy. I mean, to have something changed in your genetic makeup that will pass down through the generations. They've got too much money and they're not thinking of other people, only of themselves. And then yesterday I was on Zoom with a webinar about war in space. And I'd kind of heard about it a little bit. You know, Bruce Gagnon has a organization worldwide that's been, I think, for decades looking into this. And it's all about the control of space, and it's now becoming privatized, where Elon, what's his name, Musk or something, he's got, spaceships now, and they want to control space. They want to mine the resources in space. They want to even have setups where they can stop other countries from coming, like to say, go mine somewhere like the moon or something. And I mean, this is just insane. So they want to have lasers from space. They want to have that can kill people on Earth. They want to have radioactive substances shot into space, which could totally environmentally destroy space. And so I was also reading an article by Walter Wink about the myth of redemptive violence. And that made things clear to me too, of why we are so awash in the violence, the culture of violence. And it all came back from Babylon, where they first had this myth of how the world came to be. And I won't go on to all the details, but that is a very strong myth that violence is the solution. It's quick and we get what we want. And so I've been studying a lot about nonviolence and how folks can, have power, even though it's like we're the slaves now, and the rich people are the pharaohs. It's just that kind of system. So I've been reading a lot of Gandhi and Martin Luther King and so forth, and Martin Luther King said it's nonviolence or non-existence. So I think that these coming together like this is part of building up that culture of nonviolence. Thank you.
Amen, Anne. So well said. Thank you. Mercy, you're up, my friend. Do our little you and Noshara with our signs, I think, next.
Yes.
Thank you. Yes. Now is the time, folks, that we will enter into this place to honor folks who continue to be pushed down to the margins or pushed out into the margins when systems such as healthcare are in place that are not for everyone. We will honor folks who are disproportionately affected by the pandemic. We will show their name because they matter. We will show their name because they deserve, because they have worth. We will show their name because my people are your people, and your people are my people. We will show their name as Oshara sings.
Yes, it's gone on far too long. Yes, it's gone on far too long. Somebody's hurting our people, and it's gone on far too long. And we won't be silent anymore. I said somebody's hurting our brothers, and it's gone on far too long. Yes, it's gone on far too long. Yes, it's gone on far too long. Somebody's hurting our brothers, and it's gone on far too long. And we won't be silent anymore. I said somebody's hurting our sisters, and it's gone on far too long. Yes, it's gone on far too long. Yes, it's gone on far too long. Somebody's hurting our sisters, and it's gone on far too long. And we won't be silent anymore. And we won't be silent anymore.
Can I ask everyone to just say that one more time? We won't be silent anymore.
More.
We won't be silent anymore.
We won't be silent anymore.
We won't be silent anymore.
Thank you all for being here. We have a couple more questions for you to take home and dwell on and answer in your own journal in your own time. I'm going to pass it on to Charles to kind of give us a wrap up and a retouch on the interlocking injustices.
Okay, thanks, and people feel free to chime in because I'm sure I won't capture everything. But so we've talked about the deep social and economic failures of our society. We've talked about the disproportional deadliness of the coronavirus to people of color, to people who don't have health insurance, to people who struggle with poverty and homelessness. Talked about hunger, a lack of clean water, and how that interlocks with all kinds of different injustices that people go through. I think somebody said, hey, corporations and Wall Street and the military, they're just fine. But the 92%, the bottom, certainly the bottom 60% of the society that lives paycheck to paycheck, we're not fine. We're not fine. Talked about the idea of the more connected and the deeper community we can build, and the deeper that we can speak out of our own experience in movements like the Poor People's Campaign, the more we will begin to, the more we can have a unified social stratosphere that that creates more equality. We talked about the structures of racism and xenophobia, and this vision of what we're doing right now and being glad to see each other in this movement. This is the answer right here. Nonviolence or non-existence, and I would add, nonviolence means supporting each other, not this one like idea of well, how can I get richer off of this? For example, a president who pushes hydrochloroquine because he's got stock in it. We are the power structure. We are the power. And no, we're not in good shape now. And yes, we are pissed off. But I've also heard a lot of hope in this. This is an expanding movement. It's ultimately a movement of hope. The rural hospitals can come back, and we can. We're right on the verge, for example, of getting expanded Medicaid in Kansas, and we're not really that far from creating universal health care. So the next time a pandemic like this comes around, we'll be a lot better prepared. I'm sure I missed some stuff. Anybody else want to add anything?
Charles,
That sounds great.
I think you got us into the finish line.
So we have some announcements before we go check out. We would like to do some weekly Zoom calls, like every Wednesday at noon. Let's just call in, Zoom in, and check in with each other and have a little chat about what's happening this week, any given week. We could use some extra help writing a people's health care bill, which will, as Charles said, look a lot like universal health care. But we want to write a document that can be presented to the legislature. In the chat box, I shared our national stimulus demands petition, and I'm also going to share a Keep Us Home petition, which is some renters' demands for Kansas. And Jessica will share the Kairos Center Freedom Church of the Poor link, I think.
Yeah, I'll screen share it
Okay.
here and then I'll post the link.
Oh,
So
there it is.
The Kairos Center for Religions, Rights, and Social Justice is one of the co-convening organizations for the National Poor People's Campaign, and hosts every Sunday at 5 Central Time on their Facebook, through Facebook Live, the Freedom Church of the Poor. And so this is tomorrow's gathering of the Freedom Church of the Poor, Resurrection, Hope Among Broken Bodies. So I wanted to invite everyone to that, and I'll share the link as well.
Do we have the Zoom link for the Wednesdays as well?
We do not have that Zoom link yet. We still need to work out some little details before we can
We'll post.
get that link up. Just
We'll do the
just
same thing we
follow
did.
our Facebook page.
Yeah, we'll do the same thing we did for this, which is to post an event with a link to register, etc. So, and I have everybody who registered for this. I have your emails now, so I can send that out to you directly.
Okay.
One more thing I want to say real quick before we check out is just that the People's Healthcare Bill is something that we wrote. Let me put myself back on video. We wrote a grant to work on this around the state, and we had begun traveling around to get people's experiences. If you want to be part of a core team that works on writing what that could look like based on the feedback we've already received and feedback in your own community, we'd love to have you. Just let us know that, so you can, when I email you, you can email me back and say, yes, I want to do that. My email is, I'll put it in the chat box, and then I'll let Mary take us into checkouts. Thanks.
The only other announcement is to make sure everyone knows that our June 20th national gathering is going virtual also. So we were hoping to all congregate to DC to have a mass moral gathering on June 20th, and that is going virtual. Again, you can find so much, there's a world of information at poorpeoplescampaign.org about how to stay involved with our movement. And with that, I will let Latia lead us in a checkout.
All right, y'all. Thanks again for taking some time on your Saturday to be a part of this. I think I've run the gamut of emotions just in this short time of anger and grief and happiness. But I think that I will check out again and say that my one word that I'm feeling right now is solidarity with all of you and all of us who are fighting for our lives. And then I will pass it on to someone else. And I do hope to see all who can make it on the Wednesdays at noon so we could continue, because it's not a time to just let our emotions keep us, make us to shrink back, but it's a time to fight for peacefully for what we know are human rights. I will go with Chris.
Are there two Chris's?
There might be.
Chris left.
Okay. Well, it looks like it is a sunny day out, so that's nice to see. And so I'm feeling hopeful because it's important to understand that the road that we're walking right now has been a road that's been laid by millions and millions of people before us that have worked through injustice. And so all we have to do is keep laying that road for the people that come after us. And that's what we're doing right now. So I feel very hopeful. And I'll pass it to Sharon.
Who did you say? Did you say Sharon? I agree totally with you, Chris. Yeah, it's a nice sunny day and time to plant seeds for our nourishment and for the future generations. Thank you.
Can we pass it to Shelby?
I'm also feeling really hopeful. Every time like I kind of get into this group, I tend to feel hopeful, just for knowing that there are people in this fight still, and even when things look really desolate out there and everybody seems just really despaired, knowing that this group of people still has their hearts where they are just like really, really always makes me feel a little hopeful. And so that just feels great to me. And I will pass it to Krista.
Yeah, I myself am feeling anxious, but as far as, agreeing with Shelby about being a part of groups like this are helpful, and I feel hopeful for the movement. And I'll pass it to Anne.
I'm feeling connected and stronger. And I'll pass it to Piyush.
Thank you, Anne. I'm feeling definitely hopeful to see so many people from Kansas, to see that there's thought and hope in my area. And I really am eager to actually find something to do in my community. So yeah, I feel eager to do that. And I will pass it to Kathy.
What am I feeling? I'm definitely feeling a sense of community. We're not alone in this, and it's really just a lot of this is we have a window, to expose these injustices. People's ears and eyes. People's eyes are open right now to how important some of the essential workers that we have. People are open to that idea that they deserve basic human rights. So I think we have a good window, and I think we have a good message, and we just got to keep talking. Let's see. How about Jess?
I am feeling powerful, not because I am powerful, but because together we are powerful, and we know that there's movements like this with the Poor People's Campaign across this country, who are building a movement in this moment to end these injustices, and together we are very powerful. And I will toss it to Oshara.
Okay. I am going to say that I'm feeling privileged. And the reason why I'm using that word is because we were at the state capitol and we were protesting about the expanded Medicaid. And I said to Sarah, Reverend Sarah, I said, I don't feel privileged to be able to do this, to be able to, sit down on the steps. I mean, not on the steps, but they're in the Capitol. And then she says, yes, you are. And now that has such a bigger meaning to me, because I'm privileged to be able to say that I can be a part of standing up for things that are right and not fear You know what I'm saying? That was my whole thing, being fearful of being arrested or whatever. But now I am feeling privileged that I can be in this fight no matter what, because we're all in solidarity, black, white, whatever you are, we're all solid and we're all together. So that's how I'm feeling right now. And I'm ready. And I'm just glad that we're all in this together. And I want to pass this to Bree.
Hello, everybody. I personally just feel really very grateful right now. I have spent a lot of time thinking about these types of things, and gratefully, Oshara has invited me to just partake in this conversation with you guys, and it's really blessed me to see and to hear similar voices to my own. I haven't been able to really find that, and I'm excited about the passion that you guys have. And I'm sitting here trying to be real chill about it, but I'm really fired up and I'm about to make a video like right now. But I just want to say thank you to all of you guys for everything that you're doing. I think it's beautiful to be able to see and to hear people who are not just seeing others who have these struggles, but really people who have the struggles themselves and are willing to stand up and to fight for themselves, but also for other people. That's a beautiful thing. And I hope that none of you really even take yourselves for granted and in that fire that's inside of your bellies. So God bless everybody. Thank you.
Please stay connected. Please stay connected.
I shall.
Yay.
Who hasn't gone that we could throw it to?
How about Ashley?
Ashley, do you want to check
Yes,
out?
I'm sorry, I couldn't get it off of mute.
Okay.
I'm feeling a lot better. I was feeling pretty anxious when I got on the call. I'm feeling a sense of community. I am definitely looking forward to the future. I'm definitely pretty stoked about the solidarity. I look forward to being a part of the calls on a weekly basis. And I also look forward to contributing whatever I can to help write that bill. Because that's kind of my thing. I'm a macro social worker, so please use me if you can. I look forward to fighting a good fight with you.
We will stay connected. Who else hasn't checked out?
Thank you, Ashley.
Thank you.
Especially if you're not one of the people leading the call. Let's see, Yolanda. You still with us,
I'm
Yolanda?
optimistic.
Optimistic.
On this call, the planning that's going forth, the tenacity, and just the overall festivity. I think when people are passionate about something, a change has to come. So I'm optimistic about what this campaign is going to do. And more importantly, I'm optimistic that God is doing a great work and that the season is necessary, but he does not forsake us. So there's something going to come of this that's going to be a benefit to all of mankind.
That's right. Amen. Thank you.
Amen.
Sherry, you joined us a little bit late. You want to check out with us? Or Marcia?
Looks like Sherry posted in the chat.
Okay,
She said,
great.
yeah.
Great. Somebody so just says thanks for gathering and having technical problems, but nice to know you're out there. Great. Thanks, Sherry. We're so glad to have you. Marcia, do you want to check out for us?
I'm experiencing the awe of God. It's amazing to me the many blessings that have come out of COVID-19. When you listen to causes such as this, people seeing there's moments of despair, but people seem energized to make a positive impact on the lives of others. And I just read a quote this morning that said something, not verbatim, but something to the point of the devil thought he closed the church, but actually it's church every day now. The church has spread it. And so just like the movement of the church has spread it, people have time now to, yeah, we're all a little selfish about getting tissue paper and what have you. But once you see there's a need and somebody needs something that you have, we are sitting at home and inspired. How can I make a difference in someone else's life? And so I believe that this is such a time for this movement to take advantage and make a positive impact on others' lives. I'm finished.
Thank you so much, Marcia. I think, does anybody else on the team want to check out? I will just quickly say it's been a blessing to work with all of you, and I look forward to what we create in the future. Thank you.
So I think, are we about to end the call then, Sarah?
Yeah.
Yeah.
Can our core team stay on just a couple of minutes for debriefing?
Yes. And if any of you want to say a quick word or two as we say goodbye to everybody, please do that.
Yeah, this is Charles, and I really want to thank Reverend Yolanda for reminding us that this is seasonal, and Marcia, church is every day. Amen.
Amen.
And I just want to say the resurrection will not be televised, and I want to throw it over to Wichita Quaker.
I'm glad to have been invited to be part of this event today. It's been encouraging to me. And it reminds me again that within each of us, there is a connection with the Spirit of the living God. And if we'll just pay attention to that and not get distracted by everything else that seems to pile in on us, that we will find the strength to do what God would have us to do. So blessings on every one of you, and let's continue to encourage one another.
Amen.
If we could end with so one thing that we usually end with the Poor People's Campaign is we say, because this won't be the last conversation and way that we work together. So if we could say, if I would lead and say forward together, then we would respond, not one step back. Okay? So forward together.
Not
one step back.
One more time, forward together.
Not one
step back.
All right, have a great rest of the day.
Much love, everyone.
Our team stay on so we can finish up. And I'm going to stop recording. We don't need that to go on to the recording.